Human immunodeficiency virus, commonly known as HIV, is a viral infection that targets and progressively destroys certain white blood cells, crucial components of the body's immune system. Without appropriate treatment, HIV can lead to acquired immunodeficiency syndrome, or AIDS, which represents the most advanced stage of HIV infection. This condition leaves the body highly vulnerable to severe infections and specific types of cancers, which would otherwise be controlled by a healthy immune system. HIV is primarily transmitted through the exchange of bodily fluids with an infected individual. The most common routes of transmission include unprotected vaginal or anal sex, sharing of contaminated needles, often associated with injection drug use, and from mother to child during pregnancy, childbirth, or breastfeeding. Less commonly, HIV can also be transmitted through blood transfusions or organ transplants from infected donors, though such cases are now extremely rare in countries where blood and organ screening is routine. The virus exists in two main forms, HIV-1 and HIV-2. HIV-1 is responsible for the vast majority of infections worldwide, whereas HIV-2 is largely found in West Africa and generally causes a milder, less aggressive form of the disease. Both forms are classified as retroviruses, a category of viruses that store their genetic material as RNA rather than DNA. When HIV infects a human cell, it uses an enzyme called reverse transcriptase to create a DNA copy of its RNA, which is then integrated into the host cell's DNA. This unique process not only allows the virus to persist in the body, but also makes it particularly challenging to eliminate. The initial stage of HIV infection often goes unnoticed. Shortly after exposure, some individuals develop flu-like symptoms: fever, rash, swollen lymph nodes, and fatigue. These symptoms typically last from a few days to several weeks and are sometimes mistaken for a common viral illness. Following this acute phase, most people enter a prolonged period where they feel and appear healthy, yet the virus continues its silent attack on the immune system. This asymptomatic phase can last for more than a decade, during which the virus gradually erodes the body's defenses. As the immune system becomes increasingly compromised, individuals become susceptible to opportunistic infections and certain cancers, conditions that rarely affect people with healthy immune systems. The diagnosis of AIDS is made when someone with HIV develops one or more of these serious infections or cancers, or when specific laboratory markers, such as a critically low count of certain white blood cells called CD4+ T lymphocytes, are met. Diagnosis of HIV is made through blood tests that detect antibodies to the virus, directly measure the amount of virus present, known as the viral load, or identify viral genetic material. Modern screening techniques are highly accurate and can detect HIV within weeks of exposure. Routine HIV testing is recommended for all adults and adolescents, especially pregnant women, regardless of risk factors, to ensure early detection and treatment. Antiretroviral therapy, ART, is the cornerstone of HIV treatment. These medications do not cure HIV, but they can suppress the virus to undetectable levels, allowing the immune system to recover and function more effectively. By preventing the virus from replicating, ART dramatically reduces the risk of progression to AIDS and the development of opportunistic infections or cancers. With consistent treatment, individuals with HIV can lead long, healthy lives, and the risk of transmitting the virus to others is significantly diminished. Prognosis for people living with HIV has improved markedly since the advent of combination antiretroviral therapy. When diagnosed early and treated consistently, HIV is now considered a manageable chronic condition rather than a fatal disease. However, without treatment, most people with HIV will eventually develop AIDS, with a high risk of life-threatening complications. Prevention remains a critical aspect of HIV control. Strategies to reduce the spread of HIV include practicing safer sex, using condoms, and limiting the number of sexual partners, not sharing needles, routine testing, and treatment of pregnant women to prevent mother-to-child transmission, and the use of pre-exposure prophylaxis, pre-PE, for individuals at high risk of infection. Education and awareness campaigns also play a vital role in reducing stigma and encouraging early testing and treatment. To understand HIV at a molecular level, it's important to recognize its classification as a retrovirus. Unlike most living organisms that use DNA to store genetic information, retroviruses like HIV use RNA. After entering a human cell, HIV's RNA is converted into DNA by reverse transcriptase, an enzyme unique to retroviruses. This newly formed viral DNA is integrated into the host's genome, enabling the virus to hijack the cell's machinery to produce more copies of itself. This integration is what makes HIV infection lifelong and underscores the challenge in developing a cure. People infected with HIV may experience a wide range of symptoms, or none at all, for many years. Early symptoms, when present, are nonspecific and may include fever, rash, sore throat, and swollen glands. As the infection progresses and the immune system weakens, individuals are at risk for more severe complications, including a variety of infections and cancers. One such cancer, Kaposi sarcoma, is strongly associated with AIDS and serves as a visual marker of advanced disease in some patients. Laboratory testing is essential for both diagnosing HIV and monitoring disease progression. Blood tests to detect antibodies to HIV are commonly used for initial screening. Confirmatory tests, as well as measurements of viral load and CD4+ T cell count, are used to assess disease activity and guide treatment decisions. Regular monitoring helps ensure that treatment is effective and allows for timely adjustments if the virus develops resistance to certain medications. Treatment for HIV has advanced rapidly over the past few decades. Modern ART regimens are highly effective, often involving a combination of medications that target different stages of the virus's life cycle. These drugs are usually taken in pill form once daily and are well tolerated by most people. Side effects, while possible, are generally mild and manageable. Lifelong adherence to ART is necessary to maintain viral suppression and prevent the development of drug resistance. Without treatment, the immune system becomes increasingly compromised, leading to the onset of AIDS. This stage is characterized by the development of opportunistic infections, illnesses that take advantage of the weakened immune defenses. Common examples include certain types of pneumonia, tuberculosis, fungal infections, and cancers such as Kaposi sarcoma and some lymphomas. These conditions are often severe and can be fatal if not promptly treated. The outlook for individuals living with HIV has improved dramatically. With access to effective treatment and regular medical care, life expectancy for people with HIV now approaches that of the general population. Ongoing research aims to further improve treatments, develop vaccines, and ultimately find a cure for HIV. Prevention of HIV transmission is multifaceted. Consistent use of condoms during sexual activity, regular testing for sexually transmitted infections, and the use of sterile needles for injections are all important measures. Pregnant women with HIV can greatly reduce the risk of passing the virus to their babies by taking ART during pregnancy, labor, and breastfeeding. In addition, PrEP, a daily medication taken by people at high risk of HIV, has proven highly effective in preventing infection. Education is a key component in the fight against HIV. Public health initiatives focus on increasing awareness, reducing stigma, and promoting early testing and treatment. Early diagnosis not only improves individual outcomes, but also reduces the risk of transmission to others. In summary, HIV is a chronic viral infection that progressively weakens the immune system, primarily through the destruction of CD4+ T lymphocytes. It is mainly spread through sexual contact, sharing needles, and from mother to child. The infection often goes unnoticed in its early stages, but without treatment, it eventually leads to AIDS, characterized by severe immune deficiency and susceptibility to infections and cancers. Diagnosis is made through blood tests, and treatment involves lifelong antiretroviral therapy, which can suppress the virus, restore immune function, and prevent complications. Prevention strategies include safer sex practices, not sharing needles, routine screening, and the use of preventive medications for those at high risk. With ongoing advances in medical science, the prognosis for people with HIV continues to improve, and the global effort to control and ultimately eliminate HIV remains a top priority in public health.